Hello again, this is Colin Talbot. This is another one in our series of discussions about the response of governments to the COVID-19 crisis around the world. And this evening for them, I'm joined by Barbara Allen and Sarah Bickerton from New Zealand. And we're going to talk about the New Zealand government's response. And it's a very timely very opportune time to be discussing it, because in 4 hours time, their time, they're going to start the process of easing off the lockdown by moving from what their government calls a level 4 lockdown to a level 3 lockdown at midnight on this evening. So welcome to you both. Thanks for joining me so late in the evening for you. Would you like to both just introduce yourself? Barbara, would you like to go first?
Sure, thanks, Colin. Barbara Allen. I'm Senior Lecturer in Public Policy and Public Management at the School of Government, Victoria University, Wellington. Sarah?
Yeah, I'm Sarah Hendrik Bickerton. I guess I'm still a PhD candidate. I submitted in February about, like 3 weeks, a month before this all started happening here. And I've finished my PhD at Victoria University of Wellington, and now am doing a postdoc in the Public Policy Institute at the University of Auckland.
Oh, well done. That must be a relief.
Oh yeah, it started 3 weeks before lockdown, so it was it was a bit of an experience.
Okay, so could we start with just trying, if you could explain for me what this shift from a level 4 lockdown to a level 3 lockdown is. I'm not familiar with that terminology, and I'm sure a lot of people watching probably won't know what it is. So what are these various stages of lockdown that the New Zealand government's been using?
Sure, Colin. Yeah, kia ora, everyone. I just wanted to say really quickly, we're thinking a lot of our families and friends in England and the UK and all countries around the world. Most people in New Zealand have a very wide network, so we really feel pretty far away from you all at the moment. The alert levels is a really interesting actually set of public administration tools. We may as well get right into it. That the government announced as a way to organize how people would behave, how the government would behave, what was expected of people. We're just, as you mentioned, coming out of nearly 5 weeks of very strict lockdown, which is this level 4. I noticed in some of the media around the world, they're saying New Zealand's eliminated and that sort of thing, but really we're coming out of something called the level 4 lockdown with the strategy of eliminating the virus. Of course, it's here, and we're still a ways away. We're going to level 3, which is something called restrict, and then there's a level 2 reduce, and then there's a level 1 prepare. And we went through the stages extremely quickly on the way in or up, and it'll be a much slower process coming down. So the main change between level 4 and level 3, we've all had very tight bubbles, is what we've called it. So your closest family or your closest connections, if you had a roommate or whatever, and you may be able to relax that ever so slightly if you have a care that you want to come into your bubble, a little bit more connection with people, but still very restricted actually. And we can go into some details of what it means for businesses and things if you want, but it's a very clear and I think quite clever approach that the government has taken on that.
Did you want to add something to that, Sarah?
Oh, just basically the details. Level 4 involved pretty much every single business being restricted from being able to operate. So what we had was the only those deemed absolutely essential were allowed during level 4. So that involved things like supermarkets, what we term in New Zealand as dairies, which are convenience stores, pharmacies, some medical facilities, and that was about it. and nothing else was allowed to be operating. I know that in a lot of places that have had lockdown, they've had delivery services, takeaways, etc., that have been allowed to be delivered. We did not have that in New Zealand. We've gone through 5 weeks of having to cook our own food, which has been an interesting experience. And then there's even delivery of goods. Certain things were allowed, like winter clothing, as we're moving into winter here in New Zealand. Some computer equipment, but not other electronics, were allowed to be delivered, and that was it. They really rationed the delivery services in New Zealand. What level 3 compared to level 4 has been is that basically level 3 is described as level 4 with McDonald's. In other words, we're pretty much on the same kind of restricted levels, but we can start to get contactless delivery of food. Some of the like couriered items that you can order online will be a little bit widened. And as Barb mentioned, you can start to slightly expand your bubble.
Okay, can we just go back to the scale of the outbreak in New Zealand and just run over, because it certainly seems to have been on a much smaller scale, stopped much earlier than's happened in other countries. So I think you're counting the number of people who've been victims of it in the tens, whereas we're doing it in the thousands.
Yeah, I mean, scale is pretty important in thinking about all of this. We're a country of not quite 5 million people, right? So with that in mind, we've still had good outcomes of all of this. Today the numbers are 1,469 cases with 19 deaths, 1,180 recovered. Only 1 new case reported today, 4 probables, and we've been in the single digits for quite a few days. So that's the only way that our Director of Public Health, who's been one of the really key advisors to the Prime Minister, is pretty convinced that there's no widespread community transmission. And that's been the deciding factor for moving into a different one of our levels, the next level down. And the testing has been ramped up significantly. Again, thinking of scale, but we're currently at 123,920 tests, and we're doing between 2,000 and 6,000 tests a day with capacity for a bit more. So those are just sort of the numbers, and while it doesn't sound very much, I mean, every person's important, and every one of those people affected is there's a lot of sadness there. So the strategy here, and for all kinds of reasons, has been to try to eliminate to zero tolerance, and so there've been a lot of things put in place to try to get to that point.
Yeah, and put in place very quickly, I think. I mean, I read some of the comments from your Prime Minister saying you'd gone very hard and very fast, and I think you said earlier, Barbara, that you'd gone through the stages of lockdown up to level 4 very quickly at the beginning. Sarah, did you want to comment on that?
Yeah, it happened pretty quick. We had a bit of, one of the advantages of New Zealand was that we had a bit of lead time. We could see that it was occurring. We are a nation at the bottom of the South Pacific, so we could see that it was happening elsewhere in the world and what was occurring. So when we started to get cases in New Zealand, we had a little bit of time to see what was occurring in the rest of the world. However, once the decision was made to go, we went pretty much immediately up to a level 2, which was at the time described as social distancing. Then we on a Monday morning, 5 weeks today, they announced we were going to level 3, and that level 4 would be happening on the Wednesday evening. And right. So it was, we went up from 2 to 3, and the announcement of 3 was on the Monday afternoon, actually, come to think of it. And then by Wednesday evening, we were on 4.
Right.
So our first case was confirmed February 28th. And then there's a series of things, of course, that happened. We've been watching South Korea, some of the other important countries. We had a travel ban in place, actually, from early mid-Feb for China, and then very quickly to Iran. And cruise ships were banned, pretty important industry here, actually. and then a series of activities from mid-March on by cabinet, by government leadership, that then it's really seemed to start. Information flow was very quick after that.
And how much of this was pre-planned, in the sense that, I mean, it's quite clear from some of the other interviews that I've been doing that a number of East Asian countries were, because of SARS and MERS, were very well prepared to implement these sorts of policies. They had a clear scheme worked out in advance, and then they moved. I mean, so how much of that has been true in New Zealand, and how much of it has been on the fly reaction to what's going on?
Well, yeah, well, let's both comment on that, Sarah. That's a really interesting question, Colin. I've been looking at some of the things that have been put in place, like our pandemic planning is from 2006, the main document we're working off of, and some of the other emergency preparedness plans, and how up to date those are is quite hard to tell without a bit more research. But we are certainly a country that has, reacted to earthquakes, to volcanoes, there's a lot of sort of resilience and preparedness planning quite well ingrained in the systems, I think. So and we have had some measles outbreaks as well. So I think there's a fair amount of knowledge and built in some pretty strong administrative processes to be able to gear up. Having said that, it's far from perfect. But Sarah, do you?
Yeah, I was just going to agree with that. We have a very solid civil defence system set up in New Zealand that operates and gets up to speed very quickly with volcanic eruptions, earthquakes, whenever we have inundations, cyclones, etc., etc. So we do have that set up well. As Barb said, we've had the pandemic response legislation from 2006, but of course, we are in a different world now from 2006 compared into 2020, so there has been some changes around that. But New Zealand, to a certain extent, when the levels got announced, it was a little bit of a surprise to a lot of people. They hadn't heard these levels before, but they got to a certain extent well communicated, and so it suddenly became the lingua franca of New Zealand, of speaking about level 3, level 4, etc., and the understanding around that. So I think it came into the national consciousness really quickly, but it was one that was communicated and made sense in a really simple way.
I'd have to say that.
Go on, Barbara. Sorry. Go ahead. No, go on.
Oh, I was just going to say, I have to say the communication of that and that whole process of moving level 2, level 3, level 4, and the immediate packages and things that were announced was a masterful communication, I think.
Yeah, we'll come back to that in a minute if that's okay, because that's certainly been the focus internationally, has been on the leadership by your Prime Minister. But I just wanted to establish who's actually delivering this in government, because I mean, I know New Zealand is a unitary state, but I wonder, between central government and local government, where's the locus for delivery of all of these things? Is it actually being delivered by central government, or are the local governments really important?
Sarah, do you want to go for that?
Yeah. Okay, so New Zealand, very much, as you said, Colin, New Zealand is very much a unitary state. We're to a certain extent, we're very highly centralised. Local government, compared to a lot of other comparable nations in New Zealand, doesn't have a high degree of authority or power.
Right.
Most of the stuff is run centrally, and the local government has some basic stuff around rate setting and property management and those kind of things. But outside of a very tight and small arrangement, local government does not have a lot of power to enact things or to manage things. For instance, even with our law enforcement, police is entirely centrally managed. Right. And is not run on a location base. So There are two exceptions to that, however. One of them, which isn't pertinent, is local school boards, but the other one is what's called the DHB structure in New Zealand, which is district health boards. So our public healthcare system has a distributed system of about 20 DHBs throughout the country. It's based upon population. So the North Island has a larger amount, being the more urbanized island, has more DHBs than the South Island. And this was set up in around about 2000, where a lot of devolution of central planning around health was given to these DHBs. And run on a almost local government model, where local health boards, people were elected to them, they managed them based upon what was supposedly the idea of localized control, but with funding and directives coming from a centralized model. And so it's been in place for approximately 20 years, and there were some critiques of it, whether or not a country as small as New Zealand works well with a distributed model like that, where contrary to what is seen overseas, even though people think that New Zealand is about the size of the UK or the Japan, and we have this really small population, we're actually an extremely urbanized country. 80-something% of our population lives in urban centers. So that had a particular effect on whether or not you consider district health boards to be the right model here, and maybe a centralized model was a better way of going ahead about it. And a bunch of those questions were being raised going into the pandemic, and some questions about reforms and funding and the way in which they were being arranged them were being proposed. And since the pandemic, in the previous 5 weeks or so, there's been some questions raised about whether or not, in terms of the nature of a public health emergency like this, whether or not a distributed model is the best model to run, because, to be honest, a centralized model is easier to control, and to a certain extent, while this has gone naturally through the district health boards as part of the public healthcare system, because that's the way the system operates in New Zealand, it has been managed centrally, and the directives have come down from Wellington being the capital.
So in terms of a lot of the activities around COVID, so we have our Ministry of Social Development, which a huge hive of activity, as all the programs that the government announced. We talk a little bit about that if we have time. Also the Ministry of Business, Innovation and Employment, dealing with all the contracts, and it's a huge ministry with a lot of activity around business, trying to support our like in every place, the huge impact on the business sector. So a lot of activity through those organizations, and others as well, of course.
Okay, can we turn to the issue of leadership, because certainly that's the thing that's come across most internationally, I think, reading the European and American media in particular. Your Prime Minister, Jacinda Ardern's been getting very, very good press externally, and I just wondered what the perception is from your end. She certainly seems to have been very good at communicating clearly to the public and involving them in discussion, and the levels of compliance from the public seem to have been very good. So I just wondered what you thought about what's been going on that front.
Yeah, I think she strikes an excellent balance of sort of strong leadership in her own model, but also collaboration, and she's not afraid to share the stage. I think our Director of Public Health, Dr. Ashley Bloomfield, has been one of her top advisors through this, and he not every day, but many days, there's a daily press briefing at 1 o'clock with the Prime Minister and Dr. Bloomfield, who provide an update, provide the details they both can share in those moments. See, they have notes, but they're very good communicators, and the clarity they've been able to provide, and then they open it up to the press that are there, and really, they hold the details, and they are really able to answer them. And if they can't, They do another briefing, a follow-up later. And then the Prime Minister has also been doing Facebook Lives. A few people might happen to have come across those, and that's remarkable. She's able to both, you know, hold the more traditional press style briefing, and that same evening hold a Facebook Live from her sofa and talk to people and read chats at the same time. And it's been a fantastic show of leadership, but also, you know, it formulates an important, forgive the expression maybe, but you were asking about tools of public administration, being able to put together that leadership, that communication, that willingness to listen to the science advisors. Putting all that together has been pretty effective. I mean, none of this is perfect, but it's been effective to this point. Not to say there's not unhappiness, not you know, criticism. Of course there is, but there's been some excellent moves there. Yeah.
Before Sarah comes in, could I just ask, to what degree has there been political consensus around this, and has there been any sort of vocal opposition, or has the Prime Minister managed to involve the opposition parties in what she's been doing? Sarah, would you like to?
From a public administration and public policy, public management point of view, it is fascinating, and it's going to be great to look back on, isn't it, when we actually properly get some time to look at it. But you know, like in most of our comparable countries, Parliament was suspended, and we ended up having this epidemic response committee, cross-party, right, chaired by the leader of the opposition, Conservatives. And that was our democratic process for the last few weeks. That's been an interesting sort of watching governance in action. I think the Labour Party and the Prime Minister has watched that carefully. We have an election coming up, and there's been a reasonable balance, I think, of listening to the opposition and trying to respond, but it's not really been the time either to be able to. I think it's quite polite politics at the moment, actually. I think at the moment.
Yeah, there has been critique. We have had some debate about how long and how hard the lockdown has been. The tourism industry has been decimated. New Zealand is a nation of small and medium-sized businesses, and they're all being shut down. There has been some wage subsidy schemes that have been put in to manage the effects of that, but it's going to have and has had a huge effect on economics in New Zealand. And so there has been discussion in the media about whether or not we were taking the right line, or if it was too hard, too tough. I mean, New Zealand has pretty much taken one of the hardest lines of lockdown in the world. So we do look at other nations and question, it's like, have we done the appropriate level? But for the most part, that has been done in a polite, discussed way, and asked whether or not it was appropriate. The communication strategy that Jacinda Ardern's taken has been one of not too much detail. She set the tone of what to expect that you behave, how you behave within level 4 lockdown or level 3 lockdown, and said, okay, these are the expectations, but not go into detail, like, can I mow my child's lawn across town? We don't have rules. As level 4 went on, they realized where they needed to give more detail. About like a week or two in, a sudden directive came down to stop swimming in the ocean because of
that a lot here.
Because people do that here. New Zealanders, it's essential. Our relationship to water is really important. Our relationship to beaches is really important. And so people were, of course, thinking, I can go for a swim. But the problem is that had emergency management and emergency services ramifications. So at that point, they stepped in and made more detailed rules around that. But unless they had to, they generally took a hands-off, we're not going to make up tight rules about what you can or can't do. It was, this is what is expected of you. Make your own decisions out about what's reasonable.
Having said that, though, Sarah, the enforcement, there's been a fairly pretty good monitoring of the lockdown, and you know, they arrested some people, and so it's a combination.
Yeah, I went and donated blood platelets a couple of weeks ago, and so I had to drive across a chunk of town to be able to do so. And there were a lot of police out. You could tell they were just sitting around, just keeping an eye on things. So it was noticeable.
Can I get another detailed sort of mechanics issue? You made some reference earlier on to the amount of testing and the testing and tracking and isolating people. How effective has that been? You know, who's organised it? Because these issues are massive in Britain at the moment and in a number of other countries.
Yeah, that's been a staged increase for sure. Every single person coming into New Zealand now has 2 weeks of quarantine, whether they're citizens or otherwise. So that's been a part of, reinforcing the moat and getting a handle on it. And it's allowed for quite a lot of close tracing. There was a lot of criticism about whether the contact tracing and how robust that was, partly related to the distributed health system that we have. They put an awful lot of effort and a lot of money into boosting the contact tracing. There was a report quite quickly in the middle of April that came out with the criticisms and recommendations and what do we need to do. So there was a lot of money and a lot of effort put into that to ramp up the contact tracing, and they're all, for all intents and purposes, the Director of Public Health is now saying he's quite confident that we can effectively contact trace within a few days of needing to.
Can I just interrupt for a second and just ask, because one of the issues that's coming up in Europe in particular is the use of, and in South Korea, is the use of technology for contact tracing. Has that been happening in New Zealand, using mobile phones, for example, or is it more old-fashioned, face-to-face detective work?
Well, I'll just make one comment, and Sarah, you go. They're very much of the belief that still the best tracing is the human tracing, but going forward they are trying to ramp up the electronic tracing, and they're working on an app. Australia recently announced they've got an app working. Apparently we're 2 weeks away from having an app. They've been using Google information, basic Google information, to get quite a bit of geographic data for the moment, but it's shifting into a different phase now, I think. Sarah?
Yeah, a few weeks I was party to a discussion that was occurring online through Internet New Zealand around the question of how we were doing technologically doing contact tracing in New Zealand, and there are some questions regarding it. It's like we don't have an app yet, so all our contact tracing so far has been done the old-fashioned way, which is slow and manual. There is an acknowledgement that we need to get it to being fast and quicker. On the 10th of April, there was a report commissioned by the Ministry of Health on the state of contact tracing in New Zealand, and what were the facilities, what were the gaps. It was specifically designed to find gaps, so of course it found gaps, and identified where the improvements needed to be made. There is some question about, okay, are we doing it via an app on smartphones, but then how does that then impact those communities that smartphone distribution has not impacted, which also tends to follow the lines of which are the more vulnerable groups. Children don't tend to have smartphones. The elderly don't tend to have smartphones. The more communities that have unequal access to healthcare are also less likely to have smartphones. So there are questions being asked about what's the way this is going. So it probably is going to be a multi-pronged approach to contact tracing, where we have multiple forms of contact tracing occurring. I mean, one of the things that the Prime Minister stated today in her address was that she encouraged people that as we move into level 3 to start manually recording who you see each day, when,
right,
and where, so that people can actually start tracing that themselves.
right. Okay, I think we're coming up towards the time limit. So I just wondered if there's anything else that we haven't covered, that I haven't asked about, that either of you wanted to come in on before we close.
Well, I think for New Zealand, our Maori, our indigenous population, is an extremely important part of our country, of the way of our relationship with governance and how we collaborate in our governance of the country. And inevitably, there's going to be quite an inequitable impact on our Maori because they already have some of the worst outcomes in terms of poverty and various other indicators, and may own small businesses and that sort of thing. So there's a Maori response action plan being put in place, and there's quite a lot of things starting, and there's certainly people very, very concerned about that. So that's something that's going to be, for New Zealand, it's a critical and very important part of getting our public administration right.
Can I just ask about that, Barbara? Because there's been a big issue in the UK about Black and ethnic minority populations, both in terms of patients, but also particularly in terms of health workers. A lot of the health workers who died in the UK come from Black and ethnic minority communities, and it's not clear at all at the moment why that's the case. Whether it's something biological or if it's something cultural and organisational, we don't really know. I just wondered if there's any evidence of that sort of problem in New Zealand with the Maori population.
Yeah, I don't have the evidence. I don't know. I know there will be specific impacts on iwi, so our Māori tribes, but they're very culturally aware of the strengths and weaknesses of their own populations. Right. And I think that's all yet to come. I know that there's been a lot of pressure on the statistics and on the leadership to be honest about the statistics around the Māori in terms of actually getting COVID and that, but there doesn't seem to be any particular huge numbers there. Sarah, do you have any?
Yeah, I mean, the majority of cases in New Zealand link to a particular series of clusters and that are identified. And so, as Barb mentioned, that we have a lower level of community transmission occurring. So it's pretty much all our cases are identified to a certain amount of clusters. So you know what's occurred when that cluster occurred, and hence you can explain how that occurred. Maori are overrepresented in public health statistics, but I'd also say our concerns around the way in which Maori featuring in this conversation is the fact that it's also a sovereignty issue here, because we have a particular governance arrangement in New Zealand where sovereignty is supposed to be split and done in a partnership model. And if we had a critique of the way in which the response, public administration response, has been to COVID, it's that it hasn't been a treaty-led approach. The Treaty of Waitangi, which is what the one of the governing documents of our nation, and I would say a lot of Maori will have questions not just on about like how they're being impacted as vulnerable groups, but also in terms of the sovereignty and the consultation and the way in which this is being managed in terms of the partnership model, because I would say that's probably a critique that it possibly hasn't been.
Right. Okay. Thank you. That's really interesting. Well, thanks very much, both of you, for joining me. It's been really, really interesting. I'm sure I'll actually be coming back to you. I've said this to just about everybody I've spoken to. I'm sure I'll be coming back to you because this thing's clearly going to run and run. And there's going to be a lot of interesting public administration outcomes afterwards. So I think it'd be really useful to come back to this at some point in the future. So thanks very much for joining me.
Thank you very much, Colin.
Thanks, Colin.
Bye.